This meeting is being recorded.
Then, Ron, do you mind introducing yourself?
Sure. Good evening, folks. Ron Jones. I work for Cumberland County Emergency Management. I am the unit coordinator for our Cumberland County MRC. Our unit was formed back in 2010, and I'll talk a little bit more about the formation and the missions that we have going forward.
Great. Al, do you mind introducing yourself next?
Good evening, everyone. I'm Al May. I work for the Maine CDC. I'm the district liaison in the Down East Public Health District, which is Hancock and Washington County. And with Andrew Sankey, we co-host the Medical Reserve Corps unit for the Down East unit.
Great. Andrew, I saw you join. Are you able to come off mute?
Yeah, it's funny. It's a lot of
Yes, good afternoon. My name is Andrew Sankey. I am the director of the Hancock County Maine Emergency Management Agency. Thank you.
Thank you, Andrew. And then I see Kathy. You mind introducing yourself, Kathy?
Sure, I'm Kathy Knight. I'm the director of the Northeastern Maine Regional Resource Center. Our group is a little behind the curve right at this point in time because of COVID. And I do disaster preparedness for our healthcare system, so we were very engrossed in what was happening with healthcare at that time. So we've got some ground to make up.
Great. Holly?
Hi, I'm Holly Clayton. I'm the unit coordinator of Mid-Coast Maine MRC, and included in our area are the Saginaw, Waldo, Lincoln, and Knox County. Our unit started in early 2017, so we're completing our 6th year right now.
Great. And if folks don't mind muting their microphones, just for the duration of the presentation, it will allow for better audio. So I'm going to share my screen now. Folks should be able to see my screen. And so, oh, oopsie. So I'm actually going to hand it over to Linda to go over our national program. Linda, all you have to let me do is just let me know when to go to the next slide.
Sounds good.
Okay, great. That would normally, sorry, that was when Jennifer was going to be here. So 1 second.
That's fine. And Jennifer is your regular liaison. I'm the Region 7 liaison, and I'm currently also covering Region 3. So I'm happy to jump on board with Region 1 too. It's good to be all over the country. This is Jennifer's contact information. So if you don't have it already, please make note of that. She is a terrific resource for you. Next.
Yep.
All right, so what is the MRC? Well, if you're not familiar with the MRC, we are a nationwide network of volunteers supporting health and safety within our communities, particularly through public health, but also through a number of other different types of agencies. Mostly public health is a primary sponsor, but we have units across the country that are housed out of emergency management, out of fire and EMS agencies, out of nonprofit agencies. So almost anybody can have an MRC, right? As long as they are willing to support their unit, we can partner with a lot of different types of agencies. The MRC was started 20 years ago. We are celebrating our 20th anniversary as a demonstration project by the Department of Health and Human Services post 9/11, when we saw the response in New York and DC, and we had a lot of people, a lot of healthcare professionals that showed up, wanted to help, but really couldn't fully utilize their skills because we didn't know who they were. And you can't just let anybody into a scene like that, of course. So we recognized that there needed to be some sort of organization and way to vet those folks and get them on board and get them trained in what we needed them to actually do prior to an event happening, so that we could appropriately connect with them and deploy them when there was some sort of emergency. So in 2006, Congress passed the Pandemic and All Hazards Preparedness Act. So in 2002, the MRC started as a project, and it opened with 42 units. But by 2006, we had hundreds of units. And with the passage of the Pandemic and All Hazards Preparedness Act, we became an actual program and really started to expand after that. So today we have about 300,000 volunteers in about 800 units across the country. Next slide. So what is it that MRC does? Well, I mean, it might almost be shorter to say what does an MRC do? MRC has been involved in many different types of responses because, of course, public health touches all aspects of the world, but also supporting a number of different types of initiatives. So really, we work locally to help support the local needs of your local communities. So even though you're part of the greater MRC network, what you do, you develop your own mission at the local level, and you set your own course to meet your local needs. So there is no such thing as MRC units that look alike. If you've seen one MRC unit, you've seen one MRC unit, because they all do something a little bit different in terms of meeting their own local needs. Next slide. In terms of benefit to your community, certainly, as we have seen through the course of the pandemic, help is needed, right? Public health especially has really, and healthcare facilities have really struggled over the last few years to meet the needs between staff burnout, between staff being overwhelmed, and between just, an overall staffing shortage in those fields. So the opportunity to bolster those needs and all the other needs that kind of spring forth from them is really what the MRC was created for. So, there's always people that are willing to help. It's a matter of plugging them in appropriately and making sure that they have the training and support needed to provide the kind of help that you're looking for. And so that's what the MRC is within your community. Next slide. So this is actually a snapshot taken off of our public MRC page. And you can see there are units across the country. Certainly up here in the upper Northeast, it's pretty dense. Maine, you're not as dense, but I know you're going to get there. So we have units in all 48 states and in several of our US territories. We have very tiny units that can be tiny either because they're new or because they're in very rural areas. I cover a very rural area in Region 7, Missouri, Iowa, Nebraska, and Kansas. So we have some pretty tiny units there. And we have some huge units that cover, large and or metropolitan areas. So again, what your unit looks like will reflect the size and the demographics and the mission that you have. Next slide. So a little bit of background information here. You are in Region 1, and Jennifer covers all of that region. So you have some great units coming out of Region 1. And some of the information about the volunteers themselves, sometimes when people see the name Medical Reserve Corps, they misinterpret that to mean that we are all medical people. And while we do want and prize our medical volunteers, we also realize that in the realm of public health and safety, there's a lot of different skill sets that we need to adequately support our communities. So you can see that we have a number of support staff. These numbers are a little bit dated, but generally speaking, we always have a pretty fair number of support staff within our network, followed closely by nurses and other types of response personnel. And of course, we have continued to grow since June of 2021. So these numbers are higher than what you see on this slide. But we have a wide range of different professionals that work within the MRC. And this, of course, you're looking just at medical professionals. It doesn't take into account people that might have communication skills, ham radio, other types of skill sets that you might find useful in meeting your mission locally. Next slide. All right, so this is a bit dated. This is from our 2017 network profile. So NACCHO, the National Association of County and City Health Officials, does our reporting for us, and they're actually getting ready to pull a new profile for us. So that should be out early next year. But you can see that the MRC participates in all different sorts of emergencies, including sometimes things you wouldn't normally associate with, more of a health-based group. So certainly for infectious disease outbreaks, well, in 2017, we didn't know anything about COVID yet. That number is up over 80% as of right now of units that have participated in supporting COVID. But there's all different sorts of units and all different sorts of ways that they cover different things. We have units that are focused on veterinary professionals. And we have units that are focused on radiological disasters. So there's a lot of different ways you can think about the MRC, and there's a lot of capability within the network to address different types of emergencies. Next slide. All right, so this is from our COVID response. We just put out our final report on that. Even though COVID's not done, we tried to capture kind of the height, the first 3 years of COVID. So in our final report, we noted that we put in over 3.8 million hours, $132 million worth of value to the communities across the country. And as I said before, approximately 80% of units supported COVID throughout the last 3 years. So it was a big operation for us. A lot of opportunity, a lot of units had to flex a little bit to meet the need, because a lot of the communities had to flex to meet the need, right? This is something that was unprecedented in our time. But the MRC definitely rose to the occasion and supported their communities in a number of different ways. As you can see there from logistics, we had people that were making PPE, in the early stages when we were still making our own masks. We had people that were assembling PPE. We had people that were distributing PPE, providing mental health services, doing screening, testing, contact tracing, absolutely, supporting vaccination, doing that community outreach and providing that good information to people to get the vaccine hesitant, out and, get them caught up with their vaccines. All of that has been happening and continues to happen today across the country. Next slide, please. And I think this is where I hand off to you, if I'm not mistaken. Oh, no, I'm sorry.
There's two more slides and then I can.
Sorry about that. So a couple more about our responses. This is from 2020, but we could update this very quickly. So this year we had Hurricane Fiona roll through Puerto Rico. We were there. We had an MRC on the ground that was providing mental health support to both the responders and to community members in Puerto Rico. We have responded to numerous hurricanes in the past to help out with sheltering, to help out with mental health needs. We have helped out with immunizations that, related to tetanus and things like that for any sort of injuries. There's just all sorts of different ways that the MRC is able to plug in to support these various types of disasters. And across the country, we've seen wildfires, we've seen train derailments, flooding, all those different sorts of things. We've been there. We help out. So I'm not going to drill down, into the weeds here. Just know that if there's a way that you can think that the MRC could help, yeah, we probably have done it. Continuing on, we already talked about the hurricanes and tropical storms and the wildfires. Thankfully, we saw a few less wildfires and a few less hurricanes this year than we have in the past few years, which was a nice break. Yeah, so, we are always on call, so to speak, to assist and support at the behest of our public health and emergency management and other partners as needed. So our goal is to have our local units ensure that they are connected with those entities and that they are getting written into those plans so that they are a known partner and response asset for their communities. Next slide.
I think, yep, that is
And
all.
that's where we're handing off. So thank you. I'll hang on if there's any questions.
That'd be great. Yeah, after we present, we'll have a Q&A section at the end of the presentation.
Okay.
Thank you so much, Linda.
Sure.
So now we're going to focus the rest of the presentation really highlighting and covering our MRC units here in Maine. So just to give everyone a brief understanding of the way that our public health volunteers are structured here in Maine. So right now, I'm sure all of you are very aware of Maine Response. So Maine Response is a database that we use to support not only our emergency system for advanced registration of volunteer health professionals, which we call our ESAR VIP program, which is a federally guided program, but it also houses our Medical Reserve Corps. So if you signed up for Maine Response within the past 2 years, you were automatically assigned to your region's active MRC unit. For folks that have joined during the pandemic. Previously to that, you would opt in if you were interested in joining your MRC unit. And so it's used to house both our ESAR VIP and our MRC unit organizations. Now, our Maine Response is managed through Maine CDC, which is what I manage here. So I function as our Maine Response volunteer management coordinator. So I manage and deploy all Maine Response volunteers through that program at the bequest of requests that come in to Maine CDC. Now, our liability coverage is covered if you deploy under Maine Response, which most of our volunteers have throughout the past 2 years during my tenure. Our liability was covered through Maine Emergency Management. The difference with our MRCs are autonomous units. So as the MRC state coordinator, I help support those units, but those units are directed by that unit leadership, as well as requests and deployments are sent directly to those units. And the liability for those units is provided by the housing organization. And so we will go into a little bit more detail with that. It's just both systems work together as a team and are housed within the same database to allow that if there was a large scale disaster event, that we are able to use one database to contact folks and allow for, instead of you receiving 10 different emails, right, from 10 different organizations for the same need, we're not double counting volunteers, and we have a better understanding of where our volunteers are and what the accurate number of folks being deployed looks like. And the way that EMAs and CDC kind of work together is that in a disaster, we work together to make sure that we have volunteers to provide that coverage within the CDC level. That liability coverage is through our Maine Emergency Management at the state level. And so some of the activities that MRCs have been participating in here in Maine have been education events, emergency preparedness exercises. So those are usually done within the municipal or county level. First aid stations at fairs, festivals, community events, hydration stations, for instance, like at a 5K event that you may have in the community. Trainings, we provide trainings to the community, like CPR, stop the bleed, etc. We've also done trainings around preparedness activities to members of the community. And we've also supported vaccination clinics, including COVID-19 vaccination clinics, providing both clinical and non-clinical support. One other great idea that came up that I didn't think about before, I didn't update the slide to say this, but one other thing that can be helped is an MRC could help within a county EMA, help with any vulnerability information that needs to be collected. MRCs can work really closely with any group that they decide to really guide if it's data collection or any getting messages out to the community, whatever that looks like. It's really guided by that MRC. This is not a complete list of all the activities that an MRC can do. Activities are really guided by that unit specifically. And these are just some pictures of a community event and an emergency preparedness exercise that were done in the past prior to my tenure. And so I just wanted to highlight some of the response work that our MRCs have done in the past. So Cumberland County, we had in 2019, we had a large number of asylees come to Maine in a short amount of time, and Maine Response and Cumberland County MRC volunteers, both clinical and non-clinical, were used to support the shelter operations at the Portland Expo Center in 2019. And then in 2019, there was a emergency animal seizure and shelter operation that Cumberland County supported. And then beginning in 2020 with the COVID-19 pandemic, Cumberland County MRC helped support vaccination planning meetings, as well as making sure that most of these were also done nationally as well, but making sure that PPE was distributed to municipalities throughout Cumberland County and providing that support, as well as we supported in this year in 2022, they supported a COVID-19 and flu shot clinic, which was very successful, I hope. It was today, so I don't know the exact numbers yet, but they did it today. So you can see that we are active in the community. And then in Midcoast, MRC has been very active providing trainings throughout the community for the past few years. So in 2017, they provided to community members a training on how you are the help until help arrives. So training folks for preparedness to be able to respond to emergency situations until those emergency response workers can arrive. In 2019, they did a training on pods and pod management. So points of dispensing site is what a pod is. So for instance, a vaccination clinic would be a pod. A pod could also be if it was a distribution of any sort of material to the general public. In 2019, they helped support a community shelter training, as well as in 2021, they provided, it was hosted digitally through Zoom, so it was open to every person in the state. Was a FEMA open training, and open stands for organizations preparing for emergency needs. So we hosted FEMA representatives to come and teach that course virtually for Preparedness Month last year. And then Northeastern MRC, I don't know if Kathy Knight is still on, but they worked in 2020 to help provide support for COVID-19 vaccination planning, as well as that's supposed to also say 2020, not 202. That would be very interesting how they were active in the year 202. They provided support for alternate care site planning through their MRC unit. And our Down East MRC provided in 2020 a state MRC and strike team training, and provided in 2022 this year, they provided an overview of our MRC units to the Down East Public Health Council, as well as providing a resiliency training to their communities. And I just wanted to give you all a high-level overview of our units here in Maine. Our active units are currently highlighted. We have 4. Our units follow the public health district map that we have here in Maine. We have a total of 8 public health districts. So right now we have 4 active MRC units, 1 in Cumberland County, our second one in Mid-Coast Maine, which is Public Health District 4, in Down East Maine in Public Health District 7, and in our Penquis region in District 6. We have a total of 1,414 total members throughout our active units currently. And that is 694 volunteers in Cumberland County's MRC. In Down East, we have 133 volunteers. In Mid-Coast Maine, we have 346. And in Northeastern Maine MRC, we have 242 volunteers. I will say that Northeastern MRC, Kathy Knight's unit, is one of the oldest MRC units, not only in the state, but in the country. And I'm gonna pass it over to MRC unit leader for Cumberland County, Ron Jones.
Oops. Come on, camera. There we go. All right, thanks, Sadie. I just want to touch real quick on how we got started. We were approached by Devin Needner, who at the time was the Sadie Foucher of the ESAR VIP program, and regarding our obviously large population density and the need for some sort of public health support. We put together a core planning group of all of our Alpha 1 as an example, Southern Maine Area Agency on Aging, the City of Portland, the Strategic National Stockpile in the persona of Katie Hager from Portland, and came up with basically 4 gaps that we thought an MRC agency could fill. One of those was the Strategic National Stockpile points of dispensing. That program is pretty specific to bioterrorism type events and the need for the antidotes in fairly quick fashion. We also created, to follow the lead of the state of California, a functional assessment and support services team. Basically, what this team does is provides folks with access and functional needs who may go to a disaster shelter with an assessment initially of their needs, and then follow up with, as an example, the thing that was given to me, the young lady doing the presentation took her glasses off and said, I now am a person with functional needs because I can't read any paperwork you give me. In my case, I can't even read my screen. So I better put these back on quick. So something so simple as that, but it's going to be vital because as more and more communities in the state of Maine want to go to their own local disaster shelter program, because the Red Cross is very, very thin on volunteers, as we all are, and cannot turn out the volunteer teams in the numbers that they used to in the past, particularly if they need to open multiple shelters in multiple places. So the FAST team is sort of a special strike team that can come in, help with the health and functional needs services in the state or in the shelter. Also, we identified alternate care site staffing as a need, and worked with a couple of the hospitals in Southern Maine here to do a couple of alternate care site exercises and identify some of the shortcomings and gaps that the MRC could fill. The last one that we identified of the 4 core missions was routine mass immunizations, much like COVID is now, and the flu vaccines and what have you. So, and those have held pretty solid. Our agency is an emergency management agency, so we are covered slightly differently than the rest of the MRCs. Our sort of chain of command, if you will, goes from the county directly up to MEMA, and we receive our liability and workers' comp coverage through Title 37B, which is the Maine Emergency Management Statute. Other than that, one of the things I'm looking to try to do here in the very near future is to provide that functional assessment and support services team training to anyone in any MRC in the state and anyone in Maine Response who might be interested in, particularly if they live in a more rural county or community upstate, their services could be vital for a smaller community or even the county that may be opening up a shelter and need that assessment capability.
All right. Thank you, Ron, for presenting. We will have time for questions for Ron shortly. Next, I'm going to kick it over to Holly Clayton. She is the unit leader for Midcoast MRC.
Hello, everyone. As I said earlier, the Midcoast MRC was started in early 2017 when we called ourselves a fledgling unit, or we were called that. But then we developed, and over the past 6 years, our unit has focused on training, drills and exercises, and educational initiatives. So some of our trainings were listed in the previous PowerPoint that Sadie showed you. And I'd just like to highlight a couple of other activities that we've been doing over the past several years. The unit has had education on points of dispensing and distribution, as Sadie mentioned, also alternate care sites and the strategic national stockpile. Also, we've learned as a unit about the MRC nationwide, regionally, as we've gotten to know Jennifer. She's attended some of our statewide meetings that the Midcoast MRC hosted. And we've also learned about FEMA Preparedness Month in September each year. We've set up and staffed MRC tables at public events. Every year there's a Camden Windjammer Festival where people from, well, we learned people not just from all over the country, but all over the world to come to it. And we set up a table there, as well as at the Waldo County Preparedness Fair. And at these tables, our MRC members wore their MRC vests, and they staffed the tables and they distributed materials from a lot of the materials are available on ready.gov. And so we distributed preparedness materials, including family emergency communication plan cards, which people really liked, and also emergency supply list cards and magnets, and also public health materials on topics such as ticks. We partnered at these tables with public health and emergency management staff member came to one of the tables and sat next to us. And so we had a very good response from the community. We were able to interact with them and answer questions. And it was also a recruitment event for our unit because people got to talk to us and get to know us and see if they wanted to join. Also, we've partnered over the past several years with our local Camden Public Library, and we've hosted several lunch and learns. Now, when our unit first started, we hosted a lunch and learn with Midcoast MRC, and that was really a kind of a recruitment event. Then we hosted, and this was right before the COVID-19 pandemic, but we didn't know that was coming. We hosted a lunch and learn on influenza with a local epidemiologist from the Maine CDC. And I remember public health representatives came to that meeting as well, or that community offering. And it was a chance for the public to learn more about the role of the epidemiologist in the CDC and also protecting themselves from influenza with vaccinations. We then took that program and we offered it, our unit hosted a statewide meeting for all the MRCs in the state, and we had the same presenter do a Zoom meeting. It was like our first Zoom meeting statewide, I remember, and she presented on the same topic, and it was well received. Then our third thing that we did with the Camden Public Library is, as Sadie mentioned, we presented FEMA's open program. Actually, FEMA staff presented it, but we did the partnering work with the Camden Library, Public Health and Emergency Management, and this program was offered on Zoom. As Sadie mentioned, it was statewide. And so our partners were speaking in the presentation, and also the Mid-Coast MRC spoke and gave some preparedness tips. And this was a very well-attended, successful meeting. So in summary, over the past 6 years, our unit has focused on training, drills and exercises, and educational initiatives. We've also participated in tabletop exercises, courses, and seminars, and a summit. And I just wanted to give you a sample of some of the things that the unit has accomplished in the past 6 years. Thank you.
Thank you, Holly. All right. So Kathy had to leave us early. She had another commitment she had to jump onto. Our Northeastern MRC is located in Public Health District 6. The housing agency is Northern Light. So Kathy Knight is the unit leader. There's 242 active members in this unit, and it covers Piscataquis and Penobscot counties. And they have been very active in planning as well as emergency preparedness work, as Kathy is a very good expert on emergency preparedness, especially within the healthcare system. For more detailed questions about this unit, please let me know and I will email them to Kathy. I'm gonna kick it over now to Al to go over down east.
Great, thank you, Sadie. So a little bit on down east. Down east is Hancock and Washington counties. As you can see, it's a far eastern part of the state, right against the Canadian border, and has the ocean, obviously. And we have quite an interesting, it's quite a large area, one of the largest in the state, similar to what Penquist region and Aroostook is. I will tell you that in 2009, there was interest in forming an MRC in the Down East District, but it wasn't a district-wide idea. It was really about specific healthcare sites. And so Regional Medical Center at Lubec, which is an FQHC, was quite interested. They had staff, they wanted to get going on it. Down East Community Hospital, Machias, and a real one that was very important, really wanted to get going, was Mount Desert Island Hospital in Bar Harbor. And so they had this interest in 2009. We just couldn't figure out, because of a large area, how to figure out how to bring all these folks together. And so what happened statewide that was very helpful for us was there was a state MRC advisory committee formed to really look at MRCs and to really provide some understanding of what an MRC, provide some consistent knowledge around how you develop training and the basically logistics of an MRC, the organizational structure and all that type of thing, what kind of tiers of education you'd expect for your volunteers. That was very helpful. I know Ron was involved, and Kathy. And so around 2017, I think this is about the time Holly was talking about the one in Midcoast, all the public health districts, the 8 geographical public health districts, and there are actually 9 districts in the state. The tribal district is sort of it's a little different, so they're not included here necessarily. They're within the geographic ones, but all the districts were asked to really consider developing an MRC at the district level. And again, looking at the size of these areas, MRCs a lot of times are very local. And so it was really difficult for us to think about it, but we started considering this. And in 2019, we started having organizational meetings here in Hancock and Washington County to really start talking about this, to figure out how to do it. And in 2020, we wrote a grant, and we were one of the only people in one of the only places in the state that actually got this grant. Not a lot of money, but it was called an operational readiness grant. And basically it was a year grant that caused us to, number one, assess our readiness. Can we do this MRC? Can we develop this? Can we figure out how to recruit folks, how to develop a logistical model for an MRC in these two large counties? And part of that conversation was, even though we were hosted out of Hancock County EMA, we really thought about sort of having sub-chapters, maybe one in Washington County and one in Hancock County, just because of the size. So during 2020 and during 2021, we were holding meetings really about trying to get people to start thinking about what they wanted. It wasn't going to be dictated by myself or Andrew Sankey, but really lay it out there and talk about what MRCs can do, and then try to get people to sort of input on where they wanted to go with this. And so we developed a mission statement, a vision statement, an organizational chart, some goals and objectives. And we sort of got stuck though, because something got in our way, and that was COVID. So we kind of froze around 2021. We had some regional information meetings in Ellsworth and Machias to try to get folks to come. And most of our meetings we had, I know it says here there's 133 unit membership. Most of our meetings had a range of 5 to 12 people show up for these meetings. So that number there is a little misleading, of 133. I think those are the folks that are in Maine Responds. But we didn't get a lot of folks show up for these meetings. I will tell you though, and our unit didn't do this, but thanks to Sadie and MRC, Maine Responds, we did have a lot of local volunteers show up to help with our FEMA mobile units. These were the large units that came to different spots. We had one a 2 or 3 day vaccine set up in Millbridge, which is in Washington County, and then one in Calais. And very good help by a good number of volunteers came to both of those. Again, local people and some regional people. Another thing that I think that Sadie may have alluded to, we had a real issue in Calais, which, as you know, is way off to the east part of this, right on the border with Canada. And they had a real issue. One of the mills is close by there, and a lot of other areas. Yeah, Sadie was just putting the motion there. There was no testing going on. There was no vaccine activity. One of the hospitals was going through some problems. And so we created, with some great partnerships in town, an actual testing site and a vaccine site. And the city sort of really pulled together, but Sadie was quite helpful in getting Maine Responds to help us out there, along with public health nursing. So I think, and I don't know if Andrew wants to say anything, but I think we've got some people really interested in it. I think our issue is it's such a large area. How do we compose this to really build an MRC? And I'll stop there. Thanks.
Andrew, do you have anything to add?
I do not, other than to thank Alfred for the clarity and integrity of his reporting, and his leadership, which I'm very grateful for. Thank you.
Thank you, Andrew. Okay, and I did see in the chat someone asked about York County. So currently, I can say everyone that signed up to be in tonight's presentation, we have representation from all 16 counties here in Maine, which is very impressive. Currently, though, we do have 4 defined areas that are needing MRC units. And so those follow our public health district map. So there is one in York County, which is what we used to call our York MRC unit, which covers York County. We have Central, which covers Somerset and Kennebec counties. We have Western, which covers Androscoggin, Franklin, and Oxford counties. And then we have Aroostook, which covers obviously Aroostook County. These units, these regions do not currently have units. So we are looking to build and reestablish units in these 4 distinct regions. And so this is where we need you. And there are multiple ways to get involved. If you're interested in joining, starting a unit, or interested in unit leadership within an active unit, please reach out. We're looking with folks with a diversity of experience to really strengthen our MRCs here in Maine. And so I'm going to see if this works right. I'm going to launch a poll right now for folks. So if you are interested in leadership within our MRCs, or if you're interested in helping start an MRC unit, please let us know. This poll should be on your screen now for folks. So we'll leave that up for a few moments because we would love to hear from you. We want folks that are interested in this work to really help establish and get things moving, especially within these districts here in Maine. It's really great work. It's a great team to work with. Obviously, there is support. I would provide lots of support if you were interested in starting a unit, as well as building a leadership position within one of our active units. Yep, so we'll just leave this poll up for about 30 more seconds for folks to answer. Just a few more moments, just to make sure everyone has a chance to whether or not they would like to answer. Okay. All right, and I am about to close the poll now. Okay. And one
You hear
moment.
us?
Yep.
It wouldn't take the submit button. I don't know if anyone else had trouble. I kept hitting submit, nothing happened.
Oh, okay. Thank you.
Did
I
you-
still had to answer both questions. If you checked yes, if you check no for the one that you're a no for, I think it works. I had some
Okay.
trouble too.
Okay, good to know. The second thing I wanted to launch is we are planning to have a conference with trainings for a day-long event here in Maine. And I'd love to have some input of if folks would prefer a weekend, weekday, or both, and a preferred conference region. So yeah, you do have to answer both questions and click on one option for each question and then hit submit, is my understanding. So I'll leave this poll up. We're thinking most likely in April is when we're looking to host this. So we would just love to have some guiding input as we begin the process for this. So we'll leave this question up for about 45 more seconds for folks to answer.
Sadie, excuse me a minute, this is Gloria.
Yeah.
I have already signed up just to volunteer, but not in any type of leadership. Is this conference in spring for someone like me?
Yes, it is.
Yes.
Yeah, we'll be
Okay, thank
providing
you.
trainings and other opportunities as well.
Okay, thank you.
Yeah, this conference will be both for Maine Response and MRC. So we're going to hope to incorporate both aspects. It's very much in the beginning planning phases. So we just wanted to hear from folks and have some good general idea of where to start looking for locations and which days of the week work best for folks. All right, and I'm going to end that. All right, and now I'm going to actually stop sharing my screen and open it up for questions. So if our current MRC leaders, if you are on Zoom, if you can come on camera for folks if they have any questions. And you can unmute yourself and ask a question if you would like, or put it in the chat. If you have any questions at all, feel free. Yep.
I'll take this time just to mention that I dropped some information about the Operational Readiness Award in the chat. That is an annual award that the program office puts out. It is a small funding stream, as Al said, but we do encourage units to seek other funding. There's other funding opportunities available, sometimes even within your local communities or at the state level, but definitely at the federal level, there's other opportunities available. So, you know, there's other good information out there as well.
Oh, you're on mute if you're.
No, I'm not muted.
Oh, Ron, there's a question in the chat. How often does Cumberland MRC meet?
We started out meeting monthly, and we then went quarterly, only because of people's schedules, having to make allowances, if you will, for a lot of the medical folks who work 24/7, 365. So unfortunately, with the advent of COVID, things came to a screeching halt. So right now, I'm hoping perhaps after the first of the year to get back to quarterly meetings. We've done some in-person and Zoom meetings or Google Meets with some of our other teams, and those are meeting with some limited success. The greatest issue is that all of these teams, MRC and some of the other teams, are action folks, and a lot of the training needs to be hands-on training. So we're treading lightly right now to try to slowly ease back into the in-person training where everyone's comfortable and we're not risking folks, especially vulnerable folks like myself, with potential for, you know, coming down with the seasonal illness, whatever that may be, of a handful currently.
How many did you give today? Great. And then this can be for any unit leader. What leadership positions are you currently looking for within your unit?
I'll jump in and say yes, all of them. Partly because we would like to be able to do a yearly or perhaps biennially transfer of leadership, because one of the worst things you can do to burn out volunteers is to keep them in the saddle and say, well, will you be the director for another year, or how about another year, or maybe just one more year, and pretty soon you don't see them at meetings anymore. So that's a tough one. And I mean, I am a full-time person in the local EMA office, so I try to do the bulk of the legwork and leave the sort of team leadership to the volunteers and kind of play the Radar O'Reilly, if you will, in the background.
Great. I can answer how. So yes, if you signed up for Maine Response within the past 2.5 years, you should be in your local MRC database. And so what you can do is log into your Maine Response profile, and you have the option in Maine Response to add organizations. What you can do is add the organization for the MRC. So currently we only have 4 active MRCs. So those would be Cumberland County, Down East, Northeastern, and Mid-Coast. And so if you are outside of those regions, we would need to start a new MRC unit there. So another question for the group: every town in Maine has a local health officer. Could we reach out to that group? In my opinion, we are very underused. Sounds like that's a local health officer asking that question. And open that up to Linda, Holly, Al, and Ron to answer.
Well, this is Holly. The Mid-Coast MRC has, from its inception, has reached out to local health officers and invited them to the meetings, and we've had them attending our meetings over time. So that's in place for Mid-Coast MRC. We will continue to invite them to our meetings
Yes.
in the future.
Thank you, Holly.
You're welcome.
And yes, unfortunately, Scott, there is no active MRC in the Androscoggin region. But if you know of folks that would be interested in starting a unit there, I am more than willing to help with that. I would love to help coordinate that with you if folks are interested in that region. What type of response have you had from CERT volunteers? Do you have, I think Ron may be best equipped to answer that question.
I will say that unfortunately, CERT is one of those programs that, as the federal government is wont to do from time to time, is slowly, I think, I'll use the term, not supported by the federal government. So they haven't updated training and some of the other pieces. So we don't have, I would venture to say, a handful of CERT trained folks in Cumberland County, and I'm not aware of any active teams, CERT teams in Cumberland County. We do have, as I say, a few of the folks that were originally trained when CERT came about, but and there's not a lot of mission tasking for CERT anymore either. So it's unfortunate, because I think that the CERT program, because it is designed, it says community emergency response team. So it's there for the individual communities, and given the times, if you will, unfortunately, there's not a lot of folks that can commit a lot of time to supporting the CERTs, which is crucial. So if anybody has any bright ideas on how to do that, reach out to your local community and offer up either yourself or some good ideas to get a CERT team active in your local community. In emergency management, our mantra is all disasters are local, because that's where they start. And so if we can sort of keep that mantra going and bring it forward to folks, I will tell you, one of my struggles is figuring out how to, and I'm one of the old folks, but figuring out how to bring millennials into volunteer organizations. My observation in the past has been their motivation is they want to be able to, and I use the analogy of go down to the East End beach in Portland, gather up 8 or 10 bags of trash and have something tangible in their hands at the end of the day to say, look, I've made a difference. Where training folks for CERT or training folks for an MRC or training folks for FAST, a subset of MRC, is something that they really can't grasp, because they want to put it in their hands today and not maybe in 6 months when there's a disaster.
Thanks, Ron. Oh, Linda.
Yeah, so Ron, I fully agree with your comments. And I just want to say that regarding the younger generation, millennials, Gen Z, it really is all about getting their buy-in to your mission, right? Because they're younger people, their needs are a little bit different from some of your older volunteers. If you have older volunteers, they are established in their careers and so forth. And so they look to get something different out of volunteering than younger folks will. So it is a challenge, but it can be done. And so, it's really about getting that buy-in to your mission. And as you're developing your unit, that's one of the things that, you need to think about.
All right, we have time for one more question. Anyone has any others? Oh, I did see one. Oh, why is Linda? There was a glitch in the sign up. I do not know how that happened. I apologize. I spent some time since I've used Zoom, and I do not know how everyone got my name as their sign up. I apologize for that. Yeah, so local health officers do not have access to the Maine response list. What a local health officer can do, though, is reach out to me if they have a volunteer need, and we can communicate on that.
Sadie, just a quick, probably another way, and maybe even more local, would be to reach out to their district public health liaison.
Exactly, which
they are, I believe, under, if you will, the district public health liaison, so that relationship has already been created. And you know, as an example, Christine Jenkins in our county here has been integral. She was sitting at the seat when we had the core planning group, and so she has been in our MRC throughout and has reached out to a lot of those very same local health officers to provide the linkage to us and to other resources that they may be needed in, like I said, in the local community.
Yeah, so reach out to your local district liaison, and their information can be found online at the Maine.gov website. Any other questions? Okay, I'm gonna share my screen one more time, unless Al, did you have anything to add with that as our district liaison on site right now? Okay. All set. Okay, 1 second. All right, and just to wrap up, this is my contact information. Please reach out if you have any questions. And I will also make sure that that information gets sent to the appropriate MRC unit leader. I just wanted to say thank you all for attending this evening. And over the next month, we will be reaching out to folks based on their public health districts to begin really brainstorming for folks that do not have an active MRC unit, ideas of what an MRC would look like, working through housing agency ideas, leadership, etc. Really going through helping support that strategic planning process. So if you're interested, we are looking to reestablish and establish meetings for those local regions. So if you have a line on a specific location that we could use to meet that is ADA compliant and free of charge, please let me know. Free and ADA compliant are our two requirements for finding a meeting space that is non-virtual in your community. I would make a plug, right? Your county EMAs might be a great place to ask. And so I just wanted to say thank you to everyone for attending, and I'm going to open it to the unit leaders to say anything in closing. You can popcorn style.
Thank you all for joining us. We appreciate everybody's interest.
This is Holly. Likewise, I wanted to say thank you to everybody that joined tonight, and really appreciate you attending the meeting.
And I have to thank you, Sadie, for putting this together. I know that this has become the way that we do meetings now. And for a rural state like Maine, it's sort of a blessing in disguise, if you will, that we can now reach out to so many people so easily. But the proof in the pudding is, as Al said, you know, how do we get them all together in like his region, where it's hundreds of miles literally from one end of the region to the other. So.
And I just wanted to share on this final slide, this is the MRC programs communications page. So if you wanted to visit the MRC website, this is the address to go to, or to look at trainings. MRC Train is a great training resource page, as well as their Facebook and Twitter information. And I will be sending out a link once this recording becomes available to everyone that attended today, as well as those folks who weren't able to. Thank you so much for taking time this December evening to join us and learn more about our MRCs here at the national level and down at the local level here in Maine. I look forward to working with all of you. Have a good evening.
Thank you, Sadie. Thank you, everyone. Good night.
Good night.
Thank you. Good night.
Bye, everyone.
Bye, Sadie.